I didn't break a bone. I'd know if I did. So why the x-ray? Sure, if you've had a major fracture, you probably would know it. But sometimes that injury is more subtle. It can help rule out subtle causes, identify structural problems, and help track healing from past injuries or surgeries. Beyond injuries, we can sometimes spot benign bone tumors on x-ray that you may not even know you have. So here's the question we're here to answer. Why do I need an x-ray if I didn't break a bone? Maybe you've been dealing with joint pain for a while. Maybe your wrist has been sore for weeks, or your knee's acting up after a long run, or your shoulder just hasn't felt quite right for weeks. You head to the doctor expecting answers, and what's the first thing we order? An x-ray. Even if you're sure there's no fracture, we still want that x-ray. And today I'm going to tell you exactly why. What is an x-ray? Let's start with the basics. What exactly is an x-ray? An x-ray is a low radiation image that shows us a snapshot of your bones. It allows us to see the hard structures inside your body, things like bone contour, joint space, and alignment. Here's how it works. Bones and other dense materials show up white or bright. Soft tissues like muscles or ligaments appear as gray shadows. Air shows up as black, so even though we can't see cartilage or tendons clearly on an x-ray, we can see the effects of damage to those structures by what's happening to the surrounding bones and joint space. So what am I looking for as a surgeon? Here's what I'm scanning for when I look at your x-ray. Joint space narrowing. Has it narrowed? Is it even across the joint, or is one compartment more compressed than the others? Alignment. Are the bones sitting where they should be, or is there any shift, tilt, or rotation? Bone spurs or contour changes. These can signal arthritis, chronic stress, or overuse. Fractures, stress injuries, or healing bone. Signs of instability like dislocation, subluxation, or misalignment. All of these give me a big picture understanding of what's going on, and that's crucial for figuring out your treatment plan. So what is a weight-bearing x-ray and why does it matter? This is one of my favorite topics. Now let's talk about weight-bearing x-rays, because if you're coming in with lower body joint pain, like in your knees, hips, or feet, this matters a lot. A weight-bearing x-ray is taken while you're standing, so we can see how your joints behave under pressure, the same way they function when you're walking, running, or just living your daily life. This is dramatically more helpful than lying flat in a scanner like you would for an MRI. When you're standing, I can assess how gravity, posture, and load impacts your joints and whether that's contributing to your symptoms. It's often the missing piece in diagnosing arthritis, joint collapse, or early misalignment that wouldn't otherwise show up. But I already had an MRI. Do I still need an x-ray? I know that's a question a lot of you have. This is such a common question. Patients come to me all the time saying, I had already had an MRI. Why do I still need an x-ray? Here's the thing. X-rays and MRIs tell us different stories. An MRI shows great detail of soft tissue, muscles, tendons, and cartilage. An x-ray shows the bones and structural alignment, which we often can't see as clearly on an MRI. There are a lot of things that x-rays actually reveal better than MRIs. Bone alignment, joint space narrowing, bone spurs, hardware issues from previous surgeries, old fractures that didn't heal correctly, what we call malunions or non-unions, dislocations or subtle subluxations where the joint is slightly out of place. So yes, even if you've had an MRI, I still need that x-ray to get that full picture. But I know I didn't break anything. Do I still need it? Another big question I get is, I didn't break a bone. I'd know if I did. So why the x-ray? Sure, if you've had a major fracture, you probably would know it. But sometimes that injury is more subtle. Stress fractures can happen from repetitive motion or overtraining. Avulsion fractures occur when a small piece of bone is pulled off by a tendon or ligament, common in the ankle. Even microfractures or alignment shifts from long-term wear and tear can cause pain without dramatic swelling or bruising. These are things we might miss without an x-ray. What else can we catch with x-rays? Beyond injuries, we can sometimes spot benign bone tumors on x-ray that you may not even know you have. These include things like bone cysts, non-ossifying fibromas, osteochondromas, unicameral bone cysts or UBCs. They're often incidental findings, but it's important to document and monitor them when they show up. And if you've had prior surgery, an x-ray helps us assess if your hardware is still in place, if there's any loosening or breakage, and whether the healing process is progressing as expected. So let me wrap this up in this way. If you're dealing with limb pain, joint discomfort, or mobility issues, getting an x-ray is usually the first and most important step. It's fast, low risk, cost-effective, and it gives your doctor a roadmap for your care. Even if you don't think anything is broken, it can help rule out subtle causes, identify structural problems, and help track healing from past injuries or surgeries. And when used with MRI, ultrasound, or CT, X-rays complete the puzzle, making sure we're not missing something big. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.